Hello and welcome back to the channel. So today what we're going to talk about is we're going to talk about meniscus injuries. And I think it's a topic that comes up quite a lot in clinic. It's something that we see a lot of patients with a lot of sore knees and a lot of diagnosed meniscal injuries. Now, the thing with meniscus injuries is that they tend to come in probably two main ways. The first one is an acute sort of traumatic one where you didn't have knee pain, you were out doing something athletic or you're out living your life, and maybe you had an accident, you twisted your knee and maybe tore that meniscus or injured or irritated that meniscus. And the second group of people that tend to have meniscal issues are the ones that sort of crop up over time. So maybe it's more of a degenerative thing, or it's sort of more closely related with arthritis and those sorts of things. But the key point that I want to make here is that whether you have an acute meniscal injury where it felt fine beforehand, you had an accident and now you've got an injury, or someone's who's just gradually come on over time, this video is for both of you guys, because what I want to touch on today is we want to touch on sort of 4 things that you can do, 4 exercises to address some of the concerns that set your knee up to fail in that way. So even though you felt that your knee was great before you had your meniscal injury with in that acute way, there's every chance that there was some mechanical dysfunction there that sets you up to have a meniscal problem. And it was the moment that you heard it wasn't necessarily the start of something new, but it was the last straw, or the incident that sort of finally breached your tissue's threshold for coping, and it gives and becomes injured and you get that meniscal injury. And of course, the same thing applies to people that have these issues over time. So what we tend to find clinically is that it doesn't necessarily matter how you come to have your meniscal injury. There tends to be some baseline mechanical dysfunction and some underlying mechanical issues that are its root cause, that if you can address those whilst you're rehabbing your knee injury, then obviously you're going to go through that process a lot faster. But once your pain and dysfunction settles down again, then hopefully you've solved the reason why it was there in the first place, so you can just go on living your life without it coming back again. And I know that a lot of meniscal injuries do end up in surgery. So if you're someone who is scheduled for surgery or you've had surgery, it's really important to follow some of these guidelines, because you want to make sure that this is the last time that you have to have surgery for your knee. You don't want to be one of those frequent flyers who sort of keeps coming back every couple of years because there's some new wear and tear there, or something else is given, or touch wood, down the line you're not necessarily scheduled for a knee replacement because that knee's worn down to a nub. So again, as always with these videos, we want to make sure that not only are you treating your symptoms, which are really important, but you've got to spend time treating the underlying mechanical cause. And if you've been following this channel for a while now, you'll know that generally most knee injuries aren't just a knee injury, it's generally a breakdown of the entire leg. So it's no surprise that 2 of the exercises that we'll get to don't actually involve the meniscus itself, or the specifics of the knee itself. It's treating something above and below to make sure that you can improve the mechanics of that area. So I guess without wasting any more time, so the first thing that we want to get to is we want to go through the ankle stretch. So again, we've touched on this before, but the banded ankle stretch, so using a power band, is really, really important, because what we see a lot with meniscal injuries is a lot of ankle stiffness. And what we see a lot day to day is that if you're someone who wears heeled shoes, if you're someone who wears flip-flops or thongs, that tends to rob us of ankle mobility. It tends to stiffen our ankles because they change the way that we have to use our foot and ankle, and over time it becomes stiff. So again, if you've got any heel in your shoe, that translates to the exact amount of ankle range you don't get access to over a long period of time. And as we know with the body, if you don't use that ankle range, you do lose it and it becomes stiff. So when you need that extra ankle range and you don't have it, then your body has to work around that stiffness. And because the knee is the next joint up from your ankle, or the next major joint at least, it can then be turned from a basic hinge joint into a hinge joint with some twists and some turns and some oblique forces that it shouldn't be tolerating. And nothing, I guess, sets the meniscus up to fail like a lot of rotational sort of shearing stress. So clearing up that ankle stiffness is really important. So what we want to do is, if you have one of these power bands or any sort of band, whether it's a TheraBand or some Thera tubing, you just want something that has some resistance in it. And what we want to get you to do is we want to hook your ankle into this position, and hopefully you can see this. We want to stretch the band out as far as you feel comfortable, And all you want to do here is keeping your back heel on the ground. You want to bend that knee as far as you feel comfortable. Now, one of the common mistakes with this stretch is that a lot of people tend to squat down on it and they tend to work really hard through their quads. But what we want to do basically is we want to make sure your hips are almost past your ankle. You can bend your knee a little bit, but only to leverage that ankle joint. So you should be able to sit down in this position and feel most of the pressure down at your ankle, at the back of your ankle almost. You shouldn't feel like your legs are working too hard. And then if we were to look at you from the front, so again, imagine the band's pulling behind here. The main reason why ankle stiffness is a nasty mechanical disadvantage is because if you run into the end of your ankle range when you bend your ankle, obviously your leg can't keep going in that same direction, so it has to deviate inwards to go around it. So in order to find a way around that stiffness down at the ankle, the knee has to be put in a different position. And while it may not be as obvious as this, we see that same dumping inwards or that internal rotated mechanism, or the foot turns out and the knee caves in, and it just starts to grind and wear away on that meniscus. So again, the moment that you hurt that meniscus may have been something completely unusual, but often we find that the reason why you didn't buffer that motion or that movement, whereas someone else might, probably has a lot to do with the mechanical state of that area that you took into that accident. So that ankle stretch is really important. So holding that for 20 seconds, 30 seconds, 1 minute, 2 minutes, as long as you can fit into your day, just to get some mobility back into the joints themselves, the actual capsular stiffness that's accrued from heeled shoes and thongs or flip-flops, is a really good way to feed some slack back into that meniscus. So if you're having some meniscal dysfunction, taking away one of the handbrakes underneath that is a really good way to help that settle down faster. And then, as I said before, making sure that when your pain goes away and you feel like you've recovered, that you're not someone who has a bad knee, you're someone who used to have a bad knee because you're working on that mechanical dysfunction. Now, the second piece of the puzzle here is we want to go through the couch stretch. And again, if you've been following along on the channel, the couch stretch is a brilliant way to free up the quads and the hip flexors. And what we see a lot with tight hip flexors, when we tend to sit a lot, we're in this 90-degree position all the time, these tissues at the front of the hip and through the thigh become quite tight. And what we know happens with that is when you sort of tighten up that, the slack at the front of the leg, it puts a lot more tension through the front of the knee. But also, if you're tight through the front of your hip and you're walking and you need to let that leg trail behind you, instead of having your leg just trailing straight back, it almost has to do the same thing that your ankle forces, where it hits a tight spot here and your leg has to almost rotate around to get around that. So it can't translate back and keep everything in a good position. It almost has to rotate around that, and we can often end up in that same position. So taking off the handbrake at the front here can help you restore more linear mechanics, as well as taking a lot of the tension off the front of that knee. So it's a really important exercise to do. Now, with this couch stretch, the idea is that you want to get onto a couch. So imagine that this is the seat of the chair, this is the back of the chair. If you're more advanced, you can do it on the floor, but it's a lot more brutal. But essentially how it looks is you want to get that back knee into the corner of the chair and the back of the chair. We want to get you to pop your other leg up. So again, this will be easier if this back leg is lifted up a fair bit. Keeping your back straight, we want to come up as tall as you feel comfortable, looking for some nasty, long-term, horrible tightness through the front of the thigh, the front of the hip and down through the front of the thigh. Now, this is a little bit different to the banded ankle stretch in that we're going after more soft tissue. So we want to make sure that just holding this position isn't enough. We want to make sure that you tense up that tightness, so squeezing your thigh muscles, squeezing your glutes, pushing your foot back into the back of the chair or the wall, making these tight muscles work for a couple of seconds, then relax. You should find you can go a little bit further again. So this contract, relax stretching is by far the best way to stretch. Just holding a stretch passively doesn't work. It has never really worked, which is why a lot of people get a bit disheartened when they do it. But as soon as you start to tense up the tightness, hold it for 5 to 10 seconds and then relax, you'll see an immediate change in how far those tissues move. And then again, if your knee's irritated, if it's sore, it's going to feed a lot more slack from the top, whereas the ankle stretch is feeding a lot more slack from the bottom. And again, they're really important mechanical compromises that we need to improve if we want to make sure that you can be someone who used to have a meniscal problem and not someone who has it ongoing for many years. So that's exercise number 2. Banded ankle stretch, couch stretch. Number 3, we do want to address some of the local mechanical dysfunction at the knee, and a really good way to do that is with a ball. So this is a lacrosse ball. You can use a tennis ball, any ball. Use a foam roller if you want to, but a ball tends to be a really specific tool to use. And traditionally with a lot of knee dysfunction, we see a lot of tightness in sort of the top corner or the outer corner of the knee as your ITB, your outer quads, attach into sort of the side of that knee. So if we were to divide your knee up into quadrants where we put a line down the middle and a line across where the joint line is, it's that upper outside quadrant that often gets quite tight. Generally because the knee is often dumping inwards to compensate and cope for the ankle and the hip stiffness that we spoke about. And this outside part of the knee is often a real hot spot for tightness. And again, it's just another handbrake or a clamp on normal knee function. If you've got some irritated tissue or some sensitive tissue or some injured tissue close by, then you're going to be pulling a lot of slack out of that. So again, we want to go hunting locally on the upper outside of the knee, not on the kneecap, but just up from that. You'll know as soon as you dig a ball in because it often feels terrible. So please use a ball that you feel comfortable with. But how it looks essentially, and hopefully the camera will pick this up, but we want it to be just on the outside and we want to spend some time letting the ball sort of press in. So how this looks here, we want to lean on top of the ball. So we don't want to roll around like a lot of people tend to think. Even though it's a ball or even if it's a roller that you're using, we want to find a spot that feels really tender and tight. And then we want to use movement to shear that tissue free. So I'm sure you can see this very well. See the top of the ball there, but the idea is that you want to then just bend and straighten that knee. So you're putting some pressure on the tightness, on that restricted tissue, and then using movement to shear that tissue free. And it's an amazing way, particularly if your knee makes a lot of noise, if it crunches or it cracks and pops. It's a great way to feed some immediate slack into the knee to help those symptoms settle down. So it's a really, really good way to improve your symptoms quickly. As I said, it can be tender. So this is even tender for me and I don't have knee pain, but I'm using a lacrosse ball. I'm pushing relatively hard. So please modify it based on how you feel. But you want to start getting some movement into that because what you should find is after you've done that, when you do some squats or some movements, that should feel a little bit looser and a little bit nicer straight away. So hold me to that. It's really important. It's a great way to feed some slack into an irritated, overloaded joint. Now you can obviously get the ball into a lot of other places. Sometimes the outer calf as it attaches into the knee is also a hot spot for a lot of tightness and tenderness. You can go all the way around to the inside if you want to. It's fair game. But if you've only got 1 or 2 minutes to do one thing, go for the outside. You'll get more bang for your buck. Mechanically, it's mechanical dysfunction relies a lot more heavily on some dysfunction here than it does in those other areas. But again, go hunting, do what you need to do. It's a really good exercise. Now, excuse me, so the fourth exercise that I think is really important to touch on with meniscal injuries. So we've gone through some mobility for your ankle, so above the knee. We've gone through the couch stretch, so we're trying to take the handbrake off from above. We've gone through the lacrosse ball exercise to hopefully capture some of that local dysfunction. And they're 3 mobility exercises that are really, really helpful. So the fourth thing I think that's really important is talking strength. And I think if you have knee pain, as soon as we start talking about squats, there's a large percentage of you guys that will sort of cringe and think, crap, I can't squat, it feels sore, or somewhere down the line it won't feel comfortable for you to do that. But there's one form of squatting that should be entirely appropriate for almost everyone with meniscal issues, and it's called a box squat. Now, traditional squats, and I'll show you the technique in a second, but traditional squats like an air squat are basically as follows. And if you watch what happens to my knees when I squat down, you might see that my knee and shin angle goes a little bit more sort of horizontal. So the knee translates forward a little bit more as I sort of reach the bottom position of the squat. Those knees tend to want to swing forward a little bit. So not a lot obviously, but what happens here is if you have some meniscal injuries, that knee translating over the foot and that shin becoming sort of less vertical creates an excess of sort of forward shear through the knee. So as you come down, the femur as it sits on top of your tibia experiences a little bit more of a forward translation on top of that meniscus. So these can be a little bit uncomfortable to do for a lot of people. But what a box squat is, and I don't have a box behind me, but essentially you want to imagine that you're sitting down on the squat. So I'll need something to hold on to here. But the idea is that you imagine that the seat's behind you and you're trying to keep your shins as vertical as possible, and you're squatting down and coming back up again. So again, we're not translating forward. We're trying to keep those shins as vertical as possible with a more upright torso. And what we want to find is that, excuse me, is that when you're squatting down, you want to make sure that your feet stay straight. Those knees don't deviate inwards like the hip and the ankle may want them to. So this is obviously good to do once you've done the other exercises. You want to make sure that your feet are straight. You've created that external rotation, so your knees are rotated out, and you're just squatting down as deep as you can, keeping those shins as vertical for as long as possible before your bottom hits the seat. So, as I said, I don't have a chair, unfortunately, with me right now. I don't know why I'm puffing, but I seem to be. So the overriding factor with the box squat is that you want your bottom to translate backwards. Try to keep your back relatively tall, keep your shins vertical to limit that forward or anterior shear through your knees. So the best thing about a box squat is that you can sort of dictate how high or how low you go. So if you find that a tiny little bit of a squat is just enough before anything feels uncomfortable, it's really important that you work within that gentler range so that you can get your glutes firing, your inner quads working, you can work everything more functionally than you could with a regular squat. So obviously if your pain and range of motion allow you to squat all the way down, get your bottom to touch the seat or the bed, come back up again, go for it, but you can modify it so you don't get down as deep. So if you only have a shallow range to work with, you can put an extra pillow on top of the chair, you can put you can fold up a blanket and put it on the bed so that you don't have to go down as low, but keeping your shins vertical, sitting down with your bottom until it touches something, coming back up again, is a really great way to strengthen your knee, strengthen your hips without irritating that meniscus. So the box squat is a great introductory exercise and also an intermediate to advanced exercise for anyone with any joint related meniscal issue. But strength is obviously really important, and creating strength with the right mechanics, so keeping your feet straight, rotating those knees out so your glutes are working, holding that frame and just translating up and down, your bum going back and your shins staying vertical, I've found clinically is a fantastic way to get a lot of work and good quality work into people, even while they are a little bit sore. But again, if you're not sure when's appropriate to do, then please speak to your relevant professionals. Again, if you need to, leave a comment below, let us know how you're going with your meniscus. If you have any questions, let me know. But hopefully those 4 exercises are useful for those with meniscal injuries. Just remember that whether you had an acute injury where it came out of nowhere, your knees were good and now it's not, or you're someone who's gradually developed some over time, the mechanical compensations that are going on are generally the same for both categories. It's just that those people reached, I guess in the first category that felt fine before they didn't feel fine, they breached their threshold more acutely than someone who sort of tapped out over time. So I think those 4 principles, the ankle mobility, hip mobility, freeing up around the knee and getting some good strength in the form of a box squat into your hips and knees is a really powerful set of exercises to at least sort of form the foundation of some really strong progress over time. And remember, everything that we go through on this channel always has to be run through that filter of, does it treat your symptoms, yes or no? But are we also having a more sophisticated conversation about the cause of your symptoms? What sets you up to fail? What was going on behind the scenes that your body didn't care enough about to tell you until something went wrong? We need to address those things as much as the other things, because there's too much surgery, there's too much medication flying around, and not enough sort of actionable sort of fixes for these sorts of things. So if you went on to enjoy this video, I would really appreciate it if you could leave a like below just to let us know. Again, leave a comment if you have any questions. Let me know how your knees are going. I'll personally make sure that I respond. As you may know, I'm a huge nerd. I could talk about this stuff for hours. So please use me as a resource. And if you are new to the channel or you do sort of like what we're putting out, please consider subscribing. Again, it helps us, but it helps these videos reach more people, which is the ultimate goal. So again, thanks for joining us, and we'll see you in the next one.